Rabies is a deadly virus that can affect all mammals, including our beloved canine companions. But do dogs actually die from rabies? The answer is yes, and it's a serious concern for pet owners worldwide. Rabies is a viral disease that attacks the central nervous system of infected animals. It's transmitted through the saliva of an infected animal, usually through a bite. Once the virus enters a dog's body, it begins to replicate and spread, eventually reaching the brain. The symptoms of rabies in dogs can be frightening and distressing. In the early stages, a dog may show changes in behavior, becoming either unusually aggressive or uncharacteristically affectionate. As the disease progresses, dogs may experience fever, seizures, paralysis, and difficulty swallowing. They may also produce excessive saliva, giving rise to the classic image of a rabid animal foaming at the mouth. Sadly, once clinical signs of rabies appear, the disease is almost always fatal for dogs. There is no cure for rabies at this stage, and affected dogs typically die within 7 to 10 days after symptoms begin. The progression of the disease causes severe neurological damage, leading to coma and ultimately death. The good news is that rabies is entirely preventable through vaccination. Regular rabies vaccinations are not just recommended for dogs. They're often required by law in many countries and regions. These vaccines are highly effective in protecting dogs from contracting the virus. As a pet owner, it's crucial to keep your dog's rabies vaccination up to date. Additionally, supervise your dog outdoors and avoid contact with wild animals that may carry the virus. If your dog is bitten by an unknown animal, seek veterinary care immediately. Rabies is a serious threat to dogs and humans alike, but with proper precautions and vaccinations, we can protect our furry friends from this deadly disease. Remember, prevention is always better than cure, especially when it comes to a disease as severe as rabies.